Welcome, Doctor. We appreciate you being here.
Thank you very much. Thanks for having me. And it's very good that you're doing this on the Heart Month to spread some awareness about the heart.
So what do we need to know? I mean, I know you went to years and years of school to study the heart, but from a basic perspective, what are some of the things we're looking for in our own bodies that might signal that we have something to be concerned about?
So from a community people standpoint, heart disease, as you know, is very prevalent. And with the aging population, it gets worse. So at an individual level, you can do your own little bit of assessment to see what your risks are. So first would be your family history. So when I say family history, a lot of members have had heart disease, especially at a young age. Male members in the family, age less than 55, female members in the family, age less than 65. If they have heart disease, unfortunately, you fall in a high-risk group. That would include your parents, siblings, uncles.
Got it.
And of course, get yourself checked for diabetes, which is fairly common nowadays with the population becoming a little bit overweight. And diabetes increases your risk for heart disease, as we all know.
Yeah.
And of course, and the other big one is tobacco use, which fortunately it's going down, but still fairly prevalent. And there are some other extra things, if in women especially, during pregnancy, if they've had eclampsia or preeclampsia, they fall in a high-risk group automatically for heart disease. Yeah.
Well, prevention is obviously key because you want to prevent heart disease, like you mentioned with the smoking. That seems like an easy way to knock that off.
Yeah.
So prevention can be better than any cure, they say.
Exactly. Prevention is always better than cure. So these are the things you look for: your family history, what your glucose levels are, get your regular physicals, indulge in healthy habits. There is enough data to show that the more you move, the healthier you will be from a heart standpoint.
He said indulge, but when I hear indulge, I don't think of heart healthy choices.
Think of food.
Yes, exactly.
So those indicators can say I am more at risk, or I'm already partway down that path. If you start inching down that path and you know you're maybe in a danger zone, what are the things you can do to, if not cure, at least help your health in respect to your heart?
So you know your family history, you know the risk factors we talked about. So getting a regular physical, as I told you, getting the glucose checked and your cholesterol checked. And regular exercise is probably the simplest and easiest thing we can do. They've even come out with recommendations, at least 75 to 150 minutes of moderate exercise every week.
Oh, okay. So
per week, no.
Per day?
No.
I knew I was woefully behind, but...
About every week, about 150 minutes of exercise every week. So when you say moderate exercise, that's like cleaning your house, working in the garden. Doubles tennis falls in that category. Dancing, ballroom dancing actually falls in the moderate exercise category. Or if you are somebody who wants to do something more strenuous, then they say about 70 minutes a week should be good. And this more strenuous would fall like running. Singles tennis falls in that category, and really strenuous gardening, like, you know, if you're digging a ditch in your backyard, cutting down trees, then...
A fountain of useful information, Doctor. Yes. Thank you for being here, and our hearts are better for it. We appreciate you.
Thank you. Thanks for having us.
You're welcome. We've got such a great resource there at Gibson Area Hospital. There's a look at their Facebook and website, and we will connect everyone at CILiving.tv.